This video is to show you how to set up your new SDS surgical tray. Looking at the gray insert for the tray, you'll notice black markings throughout. The surgical tray is also set up by bone density per our drilling protocol. Bone class 4, bone class 3, bone class 2, and bone class 1. You'll also see colored grommets. The grommets correlate to the bone density: green for 4, blue for 3, yellow for 2, and red for 1. When looking at the tray, you'll also see numbers under some of the grommets. These numbers indicate the diameter of the drill or instrument above it. For example, 3.0 osteotomy drill for bone class 4, 3.8 osteotomy drill for bone class 4, 4.6 osteotomy drill for bone class 4. The circles above the grommets indicate the implant diameter path. Diameter 3.8, diameter 4.6, diameter 5.4. The surgical tray works from top left to bottom right, depending on the bone density that you're going to finish with. Looking at the marking across the top, you have RB for round burr or rose burr. You have PD for pilot drill, CS for countersink, CS for countersink. These countersinks are for D4 bone. These countersinks are for D3, 2, and 1 bone. When looking at the bottom left portion of your kit, you have this wrench here. This is used to loosen the insertion tool that's attached to the implant if it gets stuck. This ISO adapter is used to place the implant with the handpiece. It's latch fitting. This is your torque ratchet to place the implant by hand. You adjust the torque on the ratchet by turning the bottom portion of the ratchet, and it'll raise or lower the black marking in this window here to set the torque value you want. Once the torque is reached, the ratchet will break at the neck. Looking at the bottom right portion of your kit, you have 4 insertion tools. These are what we call the reusable insertion tools, because every implant comes with an insertion tool already. We have a long one and a short one, and a long one and a short one. When you look at these numbers up top here, SDS 1.1, 1.2, and SDS 2.0 and 2.2, here in the US, we have the 1.2 version and the 2.2 version. We have a long one-piece adapter and a short one-piece adapter. And the same with the 2-piece here, long and short. So if you had to change your insertion tool when you're placing the implant because of tall or short teeth or the oral cavity environment, you can take off the insertion tool that comes with the implant and put one of these instruments on. When looking at the top right portion of your kit, EXT is for your handpiece extension. It fits any latch fitting adapter. It also fits into any contra-angle handpiece. This is your depth gauge, or DG. This is what you use after your pilot drill to take an x-ray to check your depth and your angulation. The grooves that are cut into the depth gauge correlate to the laser markings or the depth markings on your osteotomy drills, which are 6, 8, 11, 14, and 17. It is recommended to purchase a few of these and have them in these extra spots here in your kit, which are open intentionally to put extra instruments. If you have extra ones of these around, when you're doing side-by-side implements, you can then use the depth gauges after you do your pilot drill to do x-rays to check your depth and angulation. These instruments up top here, SD, are for screwdrivers, short and long. These are used to put the cover screw onto the 2-piece implant, as well as to place the screw with the abutment in the 2-piece implant when you're going to restore it. It's also recommended to have several sets of these around. Buy a few more of these so you don't have to unsterilize your tray every time you want to restore a 2-piece implant. If you have any questions, please feel free to call us at 833-794-7787 or visit our website at www.swissdentalsolutions.us. You can also contact your local surgical support manager or email us at info.us@swissdentalsolutions.com.